This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, it's Jeff Ratliff, Thomas Jefferson University and the Neurology podcast. On today's episode of the podcast, I'm here with Myriam Abdennadher from Boston University and Boston Medical Center, and Divya Singhal from the University of Texas, San Antonio, and the Veterans Affairs in San Antonio. Myriam and Divya are two of the co-authors of a paper published in Neurology Clinical Practice in October of 2023 titled Work, Parenting, and Well-Being, an International Survey of Neurologists During the COVID-19 Pandemic. In this project, Myriam, Divya, and their collaborators distributed an international survey to neurologists to explore the impact of the COVID-19 pandemic on practicing neurologists with regards to academic productivity and well-being, while looking specifically at possible differences in those who had children versus those who did not, and also exploring the impact between men and women. We will get more into the results here, but it's hopefully helpful to discuss some of the prior podcasts we've done discussing gender equity in neurology. In the September 16th, 2019 episode of the podcast pre-pandemic, Stacey Clardy spoke with Julie Silver about gender equity in medicine and neurology. In the December 14th, 2020 episode of the podcast, Tisha Monteith spoke with Janice Miyazaki about gender representation within AAN leadership, publications, and awards. And in February of 2022, Tesha spoke with Elizabeth Loader about her editorial on the gender pay gap in academic neurology. And then most recently, H.E. Hinson spoke with Deborah Hall on January 9, 2023, about a paper in neurology exploring gender disparities when it comes to research careers and opportunities in neurology. And so we hope that Myriam and Divya will help us further these discussions as we get into some of the effects that the pressures of the COVID-19 pandemic had on neurologists across some of these issues. Divya, Myriam, welcome to the podcast.
Thank you, Jeff. It's a pleasure to be here.
Thank you. It's a pleasure to be here as well.
Myriam, I want to start with you, and there's certainly a lot to be extracted from the comparisons that you and your collaborators did in the course of the study. But what would you want to say to our listeners is the primary impact on work-life balance that you found across neurologists surveyed in this project?
The sudden outbreak of COVID-19 challenged neurologists' ability to do their job. At the same time, that crisis-induced financial shortcomings increased pressure for them to be productive. Our survey showed these circumstances impacting neurologists' well-being in general, and more drastically impacting parents, who constituted 91% of respondents, with decreased work-life balance, increased isolation and anxiety, and less quality time with family.
I think that will ring with our listeners. I think we all remember those pressures of productivity, pressures to see patients, and the financial burdens that might have been behind some of that. And so, Divya, in this project, your team sought to explore whether those pressures fell predominantly on neurologists who identify as women. And so when you analyzed your data to examine for differences within identified gender groups, what did you reveal? What components of work-life balance suffered? And were there other components that maybe were not disproportionately compromised when you look at that demographic in particular?
So our study showed some interesting similarities and differences across genders when talking about work-life balance during COVID. Some of the similarities we found were lack of time for academic productivity as well as writing, which also was associated with an increase in administrative burden of 48%. We also found that there was an increase in pressure to have more productivity, both from an academic as well as clinical standpoint, which of course resulted in an increase in the work hours. Not surprisingly, during this time of increased pressure and productivity, there was also a decrease in the amount of time available for writing. So there was a reduction in time for writing about 48% and a decrease in the industry research. What's also interesting here to note is that these discrepancies and burdens were more on those neurologists who have children. And within the U.S., there were similarities across genders for women as well as men neurologists. However, outside of the U.S., for neurologists identifying as women, there was a disproportionately increased burden on women neurologists. Of note, the sample size is relatively small with an N of 59, and hence it might warrant further elaboration. And talking about some of the domains of work-life balance that were significantly affected, that was an increase in stress and anxiety, as well as an increase in the amount of time that was to be dedicated to childcare.
And so turning to Myriam, beyond looking at the differences between men and women neurologists, and Divya touched on this a little bit, but you and your team also hypothesized that with changes in schools being open and daycare availability, that the pressures of COVID may have also had additional impact on neurologists who had children, anticipating that they may have needed to attend to additional childcare responsibilities at the expense of their own clinical and academic duties. And so in looking at your respondent status with regards to whether they had children or not, what did you and your team find as the areas of impact from the pandemic?
There was a big reduction in childcare availability during COVID outbreak. This was associated with increased reliance on family members or on themselves to attend to children. 74% of parent neurologists reported changes in childcare, with 35% childcare and daycare support pre-COVID dropping to 7% during COVID. 18% reliance on family pre-COVID rising to 33% reliance on other family members during COVID. This affected clinical and academic productivity, including also time available to teach medical students and residents, research activities, and increased stress and anxiety for neurologists with children.
So it sounds like, as you hypothesized, neurologists who had children at home found that they were relying increasingly on family and finding a lot more work-life conflict and imbalance when it came to addressing the childcare responsibilities during the pandemic.
Correct. Juggling more clinical and research activities while also providing childcare at the same time.
And as someone who distinctly remembers sitting in his office trying to record a podcast with a 2-year-old screaming out in the hallway back in the summer of 2020, that rings very true to me. So I think we've all been there in some way, shape, or form. And Divya, I want to ask you a little bit about telemedicine. And I think we've all noticed that one of the really universal outcomes of the pandemic is the rapid growth of the integration of telemedicine into our day-to-day lives, be it with meetings or certainly with telemedicine and delivering clinical care. And I'll speak for myself and say that before COVID, I really had minimal to no experience conducting any of my clinical encounters virtually over any telemedicine platforms. And now it's very, very much a routine part of my practice. And so what did you and your collaborators find out about telehealth or telemedicine? Does it have any association with physician burnout or other measures of work-life balance after the pandemic?
Telemedicine has really grown exponentially since COVID. Other studies that have been done have hypothesized that telemedicine might play a role in reducing physician burnout. However, our study findings actually disagree with this hypothesis. Specifically, irrespective of whether or not telemedicine was a modality used by neurologists, a majority of respondents noted that they had a lack of time for writing as well as academic work. They had less time for family, and they had heightened stress and anxiety. Of note, all of our respondents were using telemedicine in some shape or form. Less than half of them, 43%, were using it in person, and about a quarter were using it full time. So in addition to having this reduced time for family, as well as an increase in the work time, as you can imagine, that directly would contribute to more physician burnout compared to less. One interesting finding in our study also was that there were some differences in impact of telemedicine on physician burnout or lack thereof, depending on geographic distribution. Specifically for those within the U.S., telemedicine was somewhat less of a contributor towards physician burnout compared to those respondents or those identifying as women neurologists outside of the U.S. who found that it contributed somewhat more. One of the hypotheses for this might be that there could be cultural differences as well as other variables accounting for the discrepancy, which might warrant further looking into in future studies. And one more interesting thing to note is that our study also had a finding that the work-life balance was adversely affected for those neurologists who had one child compared to those neurologists who had 2 or more children. And that's another finding that would be interesting to elaborate on in future studies.
Yeah, I agree. Looking at just some of the family structure and how those dynamics might impact some of that balance. And then to go back to the earlier part of your answer and finding out that maybe somewhat unexpectedly that the advent of virtual clinical care and telemedicine was certainly not a panacea for, work-life flexibility and burnout reduction amongst the cohort that you surveyed. Myriam, in the introduction of this paper, you and your authors discussed that, unfortunately, COVID-19 is not likely to be the final worldwide health crisis. And we really need to keep in mind that any lessons we've learned from COVID should be leveraged to help us navigate future similar events. And so we've learned from what we've been talking about that these crises can have a disproportionate effect on women and on parents in certain areas of academic productivity, clinical productivity, work-life balance, hours worked, a lot of these domains that you all looked at in your survey. And so maybe speculating a little bit or trying to draw some conclusions, but what would you say are lessons learned from this paper that you think might be able to inform policies or best practices that could mitigate those disparities if some future similar health event like a pandemic were to occur again?
The data driven from our study and other work in the literature suggest a couple of things. First, that having a more robust childcare system and understanding the value of childcare could help our childcare system survive and function more effectively during crisis. Institutions could provide on-site childcare or subsidized childcare and nanny services. Local communities could reduce the burden on parents through tutoring support for middle school and high school students. We also need to continue raising awareness about gender bias in medicine on a global scale, biases that can be amplified during crisis. By relying on data-driven solutions and decision-making, institutions and foundations can mitigate disparities and improve support for neurologist parents.
I think that's really important. And I agree. Having the childcare seems so critical, and having options for parents when on-site childcare or ways to decompress some of that stress is very important. And also being aware that, when there are pressures economically and socially, acknowledging that those pressures may fall disproportionately on some members of our clinical care teams and our academic departments more so than others, and women and parents. I think that's important, just being aware of that fact that you pointed out in this study here. I've been speaking with Myriam Abdennadher and Divya Singhal about their paper that was published in Neurology Clinical Practice titled Work, Parenting, and Wellbeing, an International Survey of Neurologists During the COVID-19 Pandemic. Again, thanks both of you for joining us today.
Thank you for having us.
Thank you for the opportunity.
Thanks for listening to the Neurology Podcast. We'll see you next time.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.